Welcome to the benefit breakdown. This week's topic is the components of a health savings account, commonly referred to as an HSA. So there's two main components to a health savings account or an HSA. The first is the actual HSA qualified plan. So this would be your actual medical insurance policy. And you have to keep in mind that only certain policies are HSA compliant. So you definitely want to make sure that you have a compliant plan before you even think about the second component of an HSA, which would be the actual health savings account. So a health savings account is simply a bank account designated as a health savings account. It's going to function just like a checking account. If you've ever had a checking account, except you can only use the funds in that account for medical, dental, and vision expenses. The cool part is you can actually use those funds even for medical, dental, and vision expenses that your insurance plan may not cover. So it works for claims that are covered and claims that aren't covered. Additionally, any money you put in that account is your money forever. So it's not a use it or lose it situation. It's literally just like a checking account in every regard. It can just only be used on certain expenses. And then the main advantage to it is any deposits that you put in there up to certain limits on an annual basis are 100% tax deductible off of your taxable income. So now that we know the two components of an HSA, let's talk about the differences between an HSA plan and a traditional plan. So a traditional medical plan is generally going to have affordable copays for office visits. It'll have prescription drug copays. It'll have copays for some outpatient services and also like urgent care and ER visits. And then it will have a deductible for major medical claims. However, an HSA qualified plan is going to function totally different from a traditional plan. And that's because HSA plans don't have any first dollar copays. So what that means is all of your claims, whether it's an office visit, prescription, hospitalization, surgery, whatever it may be, those are all going to count towards the deductible first. Depending on how the plan is structured, if you meet the deductible, you may not have expenses after that, but you could still have copays that would then kick in after you had met your deductible. So it's a little bit tough for people to understand how they work the first time around because it is so different from what people are used to as far as having, just a set copay for different types of services. But that's where we really step in and educate the employees to make sure that they understand all the differences and then kind of talk through whether or not the HSA style plan would be good for them. That's all I wanted to cover today. Next week, we're going to be talking about who benefits from having an HSA qualified plan because they certainly do appeal to different types of people. So just check back in and get the second part of this presentation sometime next week. Thanks for watching and have a great day.